accepting the calendar invite and attending this short 30-minute session plan on how to complete a range of motion sit and reach test with a brand new personal training client.
Perfect.
So today, thank you for completing your learner profile. That's really helpful and insightful for me to understand how you learn.
Okay.
You got great reading, writing, numeracy, and digital skills, which is awesome. And you prefer to watch, a bit more of a visual person.
Yeah. Watch and then do it straight after.
Practically.
I remember better.
Yeah, kinesthetically. Yeah,
Yes.
which means you can apply it. Yeah, which is awesome. We'll do some of that today. So
Okay.
there's a little bit of reading to go through.
Okay.
We'll watch a quick video on how to do this, and then we will do it together.
Yep.
And then you'll give it a go, do it yourself, so we can see how you retained and understood the learner skill task today.
Sounds good.
Yeah, awesome. So before we get into the training session, we just have to run through a couple of safety and housekeeping.
Okay.
So in case of emergency, you're going to exit the office door there,
Okay.
and the emergency exit is just on the grassed area across the road there.
Perfect.
So if you do need to fill your water bottle up, the office kitchen sink is here. You
Okay.
can use that. And if you don't mind, if your phone can be on silent, so we've got
Okay.
full attention on
Yeah,
this training
absolutely.
session, if that's
We need to
okay.
do that.
Yeah, perfect. Yeah, unless it's an emergency, you
No.
can take.
All good.
Yeah,
Thank
awesome.
you.
Cool. All right, so today's session, we are, the learning objectives are to perform or how to conduct a range of motion test.
Okay.
Today specifically, we're going to be learning the sit and reach
Okay.
test, which you were talking to me about the hamstring and lower back flexibility in your
Yes.
clients, learning how to test that measurement.
Yeah.
So we're definitely going to cover that today.
Okay, great.
Which will be awesome. Then how to conduct that range of motion test with your client comfortably, and then practice that together, role playing, so that you feel confident applying this with your personal training
Okay.
clients. Yeah,
That sounds great.
yeah. We will talk a little bit about the benefits of doing this test. That's important to know how and why we do this test. Yeah,
Okay.
and then you can explain that to your clients as well.
Okay.
Yeah, and why
Sounds great.
knowing the benefits for them is helpful. All right. So, when do you think we would perform a range of motion test with a client?
I was probably thinking when you start with a client, because then you've got your base of where they are, and then you can show improvement.
Yeah, exactly.
Is there any other reasons that you would?
Yeah, this was definitely the test is performed to see how flexible they are, and how you're going to pop that into their programming to improve that if that's one of their goals. Okay. Which most people will have that as a goal.
Yeah.
Then sit and reach test or reaching for your toes.
Okay.
It's very common for people not to be able to reach for them.
Reach the toes.
So that we teach and we program exercises to help increase that. Yeah. And so why do you think it's important that we do that test with the client?
With the client? Test their flexibility, which is good to know, because then you know how flexible they are. I was kind of thinking if they're really quite unflexible and far away from reaching their toes, then it could be an indicator of an underlying issue.
Yeah,
maybe?
100%. Yeah, exactly. Perfect. Yeah. So, and if we address the range of motion early on before we start programming their exercise, then it's much more helpful in their programming, and the results are going to be better for them. Okay. Yeah. Excellent. So there are a lot of types of range of motion tests. We are going to watch a quick YouTube video of the range of motion tests. In this video, it's going to talk about another one, but I'll stop the video because today we're just focusing on the sit and reach test today. What I'm going to do is schedule another 30-minute short training session for us to go through the other range of motion test, which is
The
bone to
shoulders?
shoulder.
Okay,
Yeah,
that
correct.
makes
Yeah,
sense.
but we'll do
Okay.
that on another day. So today we're just focusing on that. Yeah, awesome. So I'll just bring the video up and we can watch this together.
I'm Naomi from Academy of Fitness. I'm now going to take you through 2 range of motion tests. The purpose of doing range of motion tests or flexibility tests is to identify whether there are any joint or muscle imbalances and whether or not our client is at an increased risk for injury. When our clients come to us, they're all wanting to improve their quality of life. And their quality of life is always going to be impeded by an acute or chronic injury. So as trainers, it's really important to identify any deviation, whether it's postural or flexibility related, that is going to increase the risk for injury, and then prescribe exercise to try and combat that. The 2 tests that I'll be doing today are a sit and reach test, which will be assessing the flexibility of the hamstrings, the glute max, and the lower back. We'll also be doing the arm under over test, or commonly called the zipper test.
So we're going to be doing that one today.
Okay.
Just giving you that, yep. We'll just-
This will be assessing the flexibility of the shoulder capsule, the joint itself, and we'll be looking at internal and external rotation. Once again, you don't need a lot of equipment. Today what I'll be doing is I'll be showing you how you can do it with just a ruler. Make sure that your client is injury-free prior to starting these flexibility tests, and don't do a warm-up, as the next time when you do your retesting, you would have to try and mimic the same warm-up again, and it makes your results less reliable. Okay, Kate, we're about to do our 3rd sit and reach. So the reason why we're doing 3 of each test is that you can take an average of those results, but it also enables your body to warm up a little bit as we do it. And it gives us a little bit more of an indication towards the end of what your true fitness is, or your true flexibility. So I'll get you to reach forward. You're going to hold your position for just a moment while I take the measurement. So when you're ready. Excellent, okay, well done. Okay, so that is a measurement of -22, which unfortunately we know that that's a poor result, and we have identified that we want to improve our flexibility. Once we start getting into the overlap, that's when we're going to start seeing some more positive results when we compare to the norms anyway. Okay, so we'll have a look at.
All right.
Okay.
Yeah.
That
How's
was
that
simple.
seem? Pretty
Yeah.
simple? Yeah. Yeah. All right. I'll just put that so we're not watching the rest of that. All right. So I'm going to give you a little handout here. So this is a really good tool to reference to keep on file for your clients.
Oh, great. Thank you.
On how to actually perform the sit and reach test, the equipment you need, the procedure, the measurement, and then if you flip the document over, there is a table where you can assess the results of your client. So this will indicate there is a male reading and a female reading. So you can assess what kind of range they do have. So if it's from super, which is really, really good and excellent, to very, very poor range of motion.
It looks like the women are more flexible than
It does on that table. It does on that table, doesn't it? Yeah.
So she had -22 on
She
the
did
video.
have -22, which meant
Very poor.
Very poor. Yeah, which is a result of very poor. Yeah.
Okay.
So we want to try and fix that in the training and the programming for the client, if your client wants to have a reading like that. It's going to be really good and fun because we're going to do that together and then do that on each other so we can see what our flexibilities actually are. A nice little practical exercise for today. All right, so she also mentioned things like making sure they don't have any injuries.
Correct.
So before we do this, do you have any injuries that I need to know about?
I do
You
get some
do?
lower back pain.
Lower back pain?
Yeah. I've seen a physio and
Yes.
he's given me some stretches to do. So
Excellent.
I'm not limited in any way, just
Yes.
not extension, which doesn't sound good.
Yeah, we're not doing that today.
This will probably help me.
It's going to be good to see what your flexibility
Yes.
range of motion is.
I'm
today.
afraid I might be very poor.
Yeah, that's okay. That's okay. We can program something.
Okay.
Right. So what we're going to do then is follow the sit and reach test.
Okay.
So this is to measure the flexibility of the hamstrings and subsequently the lower back. So the test is important because the tightness in this area is connected to the lumbar, the lower back.
Okay.
So we want to try and avoid aggravating that area of the body. So the equipment that we're going to need for this test today is a ruler, which I do have, really simple. If you have one of those,
That's pretty easy.
yeah, at home or in your office or at your personal training office, and just basically a wall or just sitting upright. So it's really
Okay.
simple, very, very simple test to do with just a ruler. It's not necessary for you to warm up, so we probably don't want the client to warm up, so we can actually get a really good indication of where their range of motion is while the body is in a cold state or homeostasis state, just in a normal state. We're gonna perform it 3 times. So we give you like a 30-second rest, and then we'll do it for the second time, and then the third time, and we'll take the readings over 3 tests.
Okay.
That's okay.
Sounds good.
So you can remove your shoes.
Okay.
The test asks you to do that. However, with your clients, if they're not comfortable doing that, just please keep the shoes on.
Okay.
Yeah, it's all about how comfortable your client feels.
Okay.
So they can keep it on. We just take that into account.
Okay.
So as long as we're measuring the test with all the same credentials,
It doesn't change.
it doesn't change. Yeah.
For that person.
Yeah. So the toes pointing up and the feet slightly apart. So like kind of like hip
width.
apart.
Okay.
Yeah. And so it's either against the base of the step or just relaxing the feet up in that flexed position.
Okay.
Yep. So we place the ruler on the ground between the legs or on top of the step or shoe, and place one hand on top of the other.
Okay.
So then the client's going to reach forward to their toes as far as they can, and then we're going to take the measurement and record that.
Okay.
Yeah. From there, we just, as long as we are recording, don't forget to record the results from each of the tests, so we can write it down and see if they improve or if they stay where they are. And then we can compare on the table here. Today, we won't be looking at men because we're female, so we'll be looking at the women columns here.
Am I doing much in between the 3 tests?
No, just relaxing,
Just
we'll have a little
relaxing.
chat, see how you feel,
Okay.
and then
Do
we
the
take
next
the
one
next
straight
one.
away.
Yeah,
Okay.
30 seconds will go pretty quickly. How does all that sound?
Yeah, I'm curious to see how we go.
Any questions?
No,
No, not at this stage?
not at this stage.
Alright, so we're going to get ready for the testing.
Okay.
Okay.
Thanks.
You ready?
Yes.
Ready to do this? Alright, so you're just going to take a seat on the floor, and just with your legs extended out nice and straight. You're going to be facing the wall here.
Okay.
Yeah.
Do you want
And
my feet
actually,
against the wall?
if you could just bring your foot in line with this
Okay.
rail line here, that's probably perfect there. Yeah, excellent. So you want to be sitting upright as much as possible. You ready for this?
Yeah.
Yeah, okay. So you're going to do up first test.
Okay.
So you're just going to reach for your toes, keeping your feet nice and flat there. Are you happy to keep your shoes on?
Yeah.
Excellent. Yeah, so you're just going to reach forward, you're going to hold it there for a couple of seconds, and I'm going to measure. You want to take them off? No problems. Take them off. That's no problems.
You can see a bit more
A
with
bit
my
better,
feet.
yeah. So we're just going to need to reposition you so your heels are in line with that line there. Yep, perfect. And keeping the feet upright, toes flex a little bit. And you're just going to reach forward to your toes.
Okay. Do you
You
want my
hold
hands
that?
on my legs or up?
If you can, bring them off the legs
Off the
and in
legs.
line with the toes, and just reach forward. Let me know if you feel
How
any.
much am I pushing? Like, do I just go
Just
to
a comfortable position, not too far. If you don't feel comfortable,
that's
um,
starting to get.
is it? Okay, so stay there. So we have a reading of and relax -6 for your first one.
Okay.
So -6, which is 6 centimeters. So we're going to have a look at this
Okay,
table.
I'm not in the
It's
very
not-
poor.
No, you're not. No, which is awesome. So a -7 to 0 is fair.
Okay,
So that's not
That's
too
fair.
bad. That's fair. That's better than what you thought, right?
it is
Yeah.
better than that.
And how did you feel? Sorry, reaching forward. You said there was a little bit of.
It's all in my lower back.
lower back.
Like,
which
I'm
you
not
do
feeling
have
it in my legs at all.
in your
It's- yeah.
hamstrings. Yeah. Okay. Yeah.
Yeah, the lower back's what's keeping me from going
Going
forward.
forward. Yeah. Which is a really good indication. So finding this out now
Yeah.
with your clients. If you were my client, I would be looking at how we can activate your hamstrings and support your lower back.
Okay.
And work on that flexibility and range. So
Yeah.
when I'm programming, this is all really great information for
Yeah,
me to
I
make
think
sure I'm programming specific to your requirements.
That makes sense.
Yes.
Yeah.
All right, let's do it again.
It's a
Test
good
number
indicator.
2.
Okay.
So same again, just relax, nice big deep breath in. And exhale and reach for your toes, keeping them nice and upright.
Ooh.
Oh, wow. Excellent. Excellent. And relax. So that was only a -1.
Okay.
So you can see how
5 centimeters.
Yeah, 5 centimeter difference in 30 seconds. Oh well, 30-second break around about that much, and
Yeah.
reaching forward again. That's really good. I wonder. And how did you feel in the back?
It
That
felt the
time?
same. I kind of went to
It
the
felt the
same
same?
amount of tension.
Okay. Yeah. Don't push it any further.
Yeah.
Just stay there. Yeah. But interesting that you can see how
5 centimeters already.
5 centimeters. Yeah.
Yeah.
Or that perhaps you felt like that was as far as you could go, but you can actually
Yeah,
go a little
maybe.
bit further.
Yeah.
I'll just watch your hip point as well,
Okay.
because we want to just make sure you're bending from the hip and reaching forward and not overextending through
yeah,
that
that could be.
spine. Yeah, so we want to just maintain an upright body
Yeah.
and then
Hinge
pivot
from-
from the hinge from the hip moving forward,
Okay.
which is probably really good to point out with your clients.
Yeah.
So remembering that could be potentially why they're reaching forward.
Okay.
And this is why we do 3 tests. So we're going to do one more again.
Yeah.
So sit nice and tall, upright, pivot from the hips, arms extended, reach forward. Yeah, hold to where you feel comfortable. You're going to go this way, because you're in the positive. And relax. Excellent. How'd that feel in the back?
Yeah.
Okay.
Yeah.
So I've got really good news for you. You went into the positive
Yay.
by 2 centimeters on the
centimeters.
3rd test.
So I'm average.
So you, which is great.
Yeah.
You're in the positive, you're average. So 1 to 10 centimeters in the positive is in the average reading. So we would like to aim to get to good and excellent. Super would be, your
Super.
yoga, yeah, your yoga masters and people like that.
Okay.
So yeah,
Okay.
excellent. Right. So we're gonna reverse the roles here. Do you feel comfortable giving this a go? And
My only question is, like, where do you put the ruler on the feet
Yeah.
to start? Yeah.
So this line here, actually, if you're more comfortable, you can place the ruler here on the 0
on
reading.
the 0.
And then,
yeah.
so as your hands come forward, you can take your eye gaze over the top and measure the centimetre this way.
Okay.
If there is going to be a positive reading, the ruler needs to sit on
On
this
the
side.
Okay.
Yeah. So this is 0, so where the top of the toe is, or the line here,
Yeah.
is 0. Anything towards the body is
It's gonna be
minus.
negative.
Anything away is going to be
Okay.
positive. So just placing the ruler there.
Okay.
If you're using the ruler for the testing, that's the best way to do it.
All right.
Okay.
Sounds good.
Yeah.
Are you gonna leave your shoes on? or
I
you gonna-
will take my shoes off, I think, and then we can get a really good reading. Okay. All right, so leave that down there if you want to go through.
Okay.
the
Yeah, or
steps
and I'm
on how we're doing
explaining it to
Yeah.
you as well.
Yeah.
Okay. All right. So if you want to come down and have a seat, you want your feet facing towards the
Mhm.
wall, and then
Okay.
if you want, is you. clean socks.
Yeah.
Maybe some clients you don't want them to take their shoes off.
You might.
Alright, so you're on that line, you want your feet hip width.
Yeah.
So I'm explaining the whole process.
Yeah.
Yeah. So this is a sit and reach flexibility test. We'll be doing it 3 times. We don't want you to warm up, so it gives us a good base, and then we'll average the 3. We'll take about a 30-second break in between each one. We don't want you reaching through your shoulders. You want to be hinging at your hips. And you just go to where it feels a little bit uncomfortable, but it's not painful.
Okay. Yeah. Okay.
Do you have any questions before we start?
No, I think that's right. As long as you direct me,
Okay.
it'll be good. Yeah, be interesting to see.
See
Yeah,
how you go.
I did do a run this morning, so I'm not sure. I find it a little bit tight.
It might make
So-
it tighter, or it might
Don't
make it loosen you up.
I
We'll
don't
see.
know. We'll see what happens.
Okay. So
Yeah.
your feet look good. Maybe just bring them up just a little bit, and then
Okay.
bring your hands
Yeah.
up. And then when you're ready, just reaching forward till you feel. Oh, look at that! You've gone. Flip this around. So, okay.
Yeah.
It goes by the middle finger.
Yes.
So
Yes.
two,
Two
two.
centimeters.
You're +2 on the first one.
Oh.
So how did
okay.
it?
That's okay. I did feel like there was a little tightness in my lower
So
back.
lower, did you feel
Lower
anything in your hamstrings?
Not
or was it
yet.
all lower back?
Yeah, at this stage, just lower back.
Lower back.
Yeah.
It'd be interesting
Yeah.
to see when if you go further on the next one, if it then goes into your hammies a little bit.
Yeah, it's actually trying to maintain that nice straight posture.
I'll tell you to breathe in this
Yeah,
time as
yeah.
well.
That's a good
As you breathe out, you might get a little bit more of
relax
that
a little
breath.
bit more. Yeah. Being that you do yoga as well, they teach you that, don't they?
Be good to do this after yoga
Yeah.
to see the
Yeah,
difference before and after.
exactly. Yeah.
Okay, are you feeling ready?
Yep.
Do you want to
Yep.
give it another try? So that's it, big breath in, nice and tall, and then we're going to get you to hinge from those hips. Oh, look at that. 4. Perfect. How did that
2
feel?
centimeter
Two
difference. Yeah, good actually. I didn't feel any tighter or anything, just felt the same as it
Felt the
was.
same.
Yeah.
That's really interesting how much you can get out of just doing one coming
And
out.
this typically is a very typical result for clients.
Okay,
Yeah, with the sit and reach test. Not warmed up.
not warmed up.
Yeah, and you can also take this training a little bit further and test them after their session.
After the session.
So yeah, after you've done a one-on-one personal training
And so
session
would
with
you
someone.
think it to be better, like more flexible
I
because
think
they're
yes.
warm? Yeah. Okay, that makes sense.
Generally, you would find that their range of motion results will be better after their training session. Yeah.
Maybe next day less because it's sore.
Yeah, they'll be sore, exactly, yeah, exactly.
All right, how are you feeling? Are
Yeah,
you ready
good.
for your next
Yeah.
one?
I hope I can add another 2
Okay,
centimeters.
so again, just hinging at your hips, big breath in, and then as you exhale. Yep. Okay. 5. Oh, you got 1 out.
Yeah,
of
that was,
one.
I actually felt that one in my
And your hammies.
hamstrings.
So it's
yeah.
changed from
Yeah.
your lower back.
That
So
has changed a little bit. Yeah, you
So
can
from
feel
that,
it.
I would then maybe an indicator your lower back's a little bit tighter than your hamstrings.
Yeah, yes, definitely. Yeah.
Is there a way to? Well, it's like another thing, but how would you take the stretch out of the lower back and put it into the
Into the
hamstrings?
hamstrings, yeah, that's a really good question. And we will train on that as
Yeah.
well. But yeah, there's some certain exercises that we can
Yeah.
program for the
For
client
that.
to remove it from the lower back and get activation through the hamstrings.
Perfect. Otherwise,
And
I'd be
the
limited the whole
glutes.
time with my lower back.
Very much so,
Yeah.
yeah. And talking to your client constantly, communicating on how they feel,
Yeah.
is going to help you indicate whether it's now extending through the hamstrings or
Yeah.
extending through that lower back. Because the goal is to improve that range of motion and flexibility through.
Okay, so
The
good to
constant
ask them
change.
that question as they're stretching where they
Yeah.
feel it the most, and then that's
Yeah,
maybe
exactly.
an indicator like you've got in your paper when it
Yeah.
says whether it's the lumbar or the pelvic
Mhm.
tilt.
Yeah, and then so this is just scratching the surface of this test. There's so many other things that we can go through.
Yeah.
And I'm going to give you some resources so that
Oh,
you
excellent.
can do some study later on. And it's just really helpful for the client to know that one, you're educated in that, they're in really safe
Yeah.
hands, and two, that your programming is going to be
Specific to them, so they
Yes.
really feel like it's an individualized
Yes.
after
Yeah.
exactly what their needs
Absolutely.
are.
Yeah. So, on a scale of 1 to 10, 10 being
Yeah.
amazing, I'm so confident in this, and 1 being, not really sure.
Oh.
How did you feel after that? You feel
I think a 10.
Yeah,
I'm
yeah,
comfortable
confident?
with that.
Yeah.
Yeah.
Yeah,
But
excellent.
I have learned a bit.
Yeah.
Yeah. No, it's really good.
Did you want to take some more time to do any more testing, or do you think that's it? And
I'm pretty happy,
happy with that? Yeah, excellent.
I think the test itself is pretty simple.
Mhm.
I think I got more out of learning like where the tightness could be
Yes.
and the questions
Yes.
to
Yeah.
ask around that,
Yeah.
and maybe the indicators then I could use further in my
Yeah.
programming to make
Yeah.
it specific for that client.
Excellent.
And the
excellent.
other thing that I really found quite interesting is how much difference you could go after just taking a short break and then
Yeah.
extending again.
Yeah, you can see when we do it 3 times because the
Yeah.
first reading could be quite poor,
Yeah.
but it could just be the setup of the test, and then the client getting comfortable doing that, just that movement. So you can
Yeah.
see the test is very, very simple. It's such a simple
Very
test.
simple.
You know, our education and knowledge comes in the programming and how we're going to improve that
Yeah.
flexibility and range of motion.
Yeah, the
Which we will
communication.
do some more training
Yeah.
sessions on that.
Okay.
Yeah, so we're
That
happy
sounds
with that.
great.
We'll go to some resources and some feedback.
Perfect.
That's okay?
Sounds great.
Yeah. Let's put our shoes back on. Alright, so we're all feeling comfortable about that.
Yeah.
So this form is for you to take home.
Okay,
so you
great.
Can copy that.
Yeah.
And have as many copies ready to go as you need for your clients.
Okay, so I can copy. You don't mind if I use this?
That is for you. That's your resource
Okay,
to
great.
use with your clients. Yeah, yeah. You can access those ones on the Top End Sport website, which
Okay.
I popped in the resources for the
Perfect.
feedback.
Okay.
Yeah. So from here, feel comfortable with all of that. I'm really happy with how you.
Okay. Is that all right?
Yeah, that you applied
You're
all of that.
confident I can do that
Absolutely.
with-
Yeah,
with you?
definitely confident. Yeah.
Okay.
Yeah, so there is, well, I'll send you that link to the video training as well, so you can have
Yeah.
a look at the other range of motion tests, but I will be sending out another further training, a 30-minute training
Okay.
on the over
On
under
the
reach
shoulders.
test, so we can do
Yeah.
that one and break that down and go into a little bit more detail.
Okay.
Yeah. So before I give you the feedback form on
Yeah.
the session here, because that's really helpful to me,
Okay.
and also to the learner, to know that I'm covering everything that you're actually
Okay.
wanting to learn.
Yeah.
And if you found it really helpful, so I really appreciate if you could
No
do
worries.
that for us. But are there any other questions you had from here?
No, I don't think so. But if something comes up, can I reach out?
Absolutely, yeah. So my email address is in
Okay.
the calendar invite, so if you want to reach out to me, just send me an email at any time. And,
Okay.
yeah, I can help
Thank
you
you
out.
for that.
Yeah.
I
You
appreciate
have you have questions with your clients.
Yes.
They're probably going to
then
ask some
something
curly
might come
questions.
Up.
Yeah.
Or
So-
some strange injuries, maybe.
Yeah, exactly.
Yeah.
Injuries. Yeah.
Okay.
Yeah, so that's how we delve a little bit deeper into
Okay.
that kind of that training. So I've got a feedback form here.
Okay.
For you to complete, if that's okay.
Yeah, absolutely.
Take your time. Be as honest as
Okay.
you can, please. So it helps with our future learning training sessions. I'll give you a little moment to do that.
What was this session title again?
This-
what
This
the
session
exact-
title specifically is how to complete a range of motion sit and reach test. Yeah, so sit and reach today. go home and Google how to increase your flexibility.
I think so. Lower back for sure. I want to do the yoga and see how much it is, even if I just did some salutations and then test it again.
Yeah, that'd be good to do.
It's good to have that benchmark because then you know where you sit, which the clients would. You see the
Specifically with personal
improvement,
training, yeah, we need to have those tests or those baselines so we know how to improve it. Do you have some clients booked in to try this album?
Yeah, I'm hoping this coming week I've
Yeah.
got somebody that wants to come in.
Yeah.
And they're a little bit older as well, so this flexibility could be good.
Yeah, definitely.
And we can really target.
Yeah, that might be another question actually later
That
on.
could
because
be.
if they're aged, you can do the sit and reach test standing up too. So there's other
Okay.
ways to do it.
Yeah, that might be better
Mm.
because if they've got any issues getting up and off the floor could
Yes, yeah.
could
So
be a
thinking
problem.
about all those things. So
Yeah.
which it's normal to have questions after a training session.
Yeah.
So find to connect those.
Can't think of anything at
Yeah.
the moment. I feel like
Yes.
we've covered
Yeah.
everything.
Yeah, that's awesome.
But
But yeah,
but
if
then
you do
with
have those
other-
clients,
yeah.
come through. Yeah, just reach out to me and we can assist you
yeah,
with that.
because some
Yeah.
clients it's not
No.
straightforward. Well,
Thank
thank
you
you for
so
your support
much,
and
yeah.
being able to reach out if I have
Yeah.
any issues.
Yeah, excellent. Thank you for your time, and that was
Yeah.
awesome. Really
Thanks,
good
Brenda.
session.
I appreciate
Thank
it.
you.